my name is Caroline Arndt, and I'm going to be presenting my case analysis on JS, a 58-year-old Caucasian teacher who lives with her retired husband. She is a middle-class empty nester that has a current history of hypertension, anxiety, rheumatoid arthritis, hypothyroidism, and gout. These are her prescribed medications. She currently takes 100 milligrams of losartan daily for hypertension. For anxiety, she takes 75 milligrams of venlafaxine or Effexor daily. For rheumatoid arthritis, she's prescribed hydroxychloroquine or Plaquenil, 200 milligrams twice daily. She states she does not take her nighttime dose as it's easy for her to forget and it causes GI discomfort. For hypothyroidism, she takes levothyroxine or Synthroid, 75 micrograms daily. She's also prescribed allopurinol, 100 milligrams twice daily, but she has not recently refilled her prescription. She states she's fearful of restarting the allopurinol due to possible acute gout flare-up. She also takes an occasional 200 milligrams of ibuprofen as needed for pain. She has a history of a hysterectomy, a partial thyroidectomy. She has no known drug allergies, is a non-smoker, but she does consume 2 to 3 glasses of wine every night. Overall, through this experience, I really learned a lot of important information that I can take away. For example, many of her medications are metabolized by the same enzyme. Losartan and ibuprofen happen to be 2 of those medications. This can greatly decrease the effectiveness of the medication by causing competition between the 2 drugs. I also learned the importance of completing a medication adherence assessment on every patient. JS knows exactly what medication she's taking, why she's taking them, their dosage. She has a college education, and she also has no issues with the cost of her medications. You would think there would be no barriers to compliance. Well, it turns out that's not the case. She still does not comply completely to her regimen. She states she doesn't take her second dose of hydroxychloroquine because it causes GI upset and it's difficult for her to remember. It's the only medication she takes twice daily versus once daily. This shows that simplifying a patient's regimen can really affect their compliance. If possible, once daily meds are ideal. This also shows that adverse drug reactions such as GI upset can really deter patients from taking their medications as needed. By completing a patient medication adherence assessment, this can really open up dialogue and help the provider to adjust issues with compliance. Also, with her allopurinol, her gout medication, the patient is correct in that restarting that medication could cause a flare-up, but you should never abruptly discontinue that medication due to an increase in uric acid. There are also solutions for decreasing the chance of an acute gout flare-up, such as initiating an NSAID 2 weeks prior to restarting the med, and also starting the med in increments. Throughout this whole experience, I also realized the importance of screening for alcohol use. JS drinks 2 to 3 glasses of wine nightly, and this can really affect her drug metabolism. Overall, I realized how complex polypharmacy can be and how important it is to not only make sure the medications work together safely for the patient, but also effectively. I will definitely be able to utilize this experience in the future as a provider. Thank you.